People are coming in. Hello, everyone. Hi. 34 people. Hello, everybody. So time is 3 o'clock. Welcome, everyone, to Senior Immigrant Safety Expo, hosted by A&O Support Services for Older Adults, with funding from New Horizons for Senior Program. And I just want to acknowledge the land where we are hosting this event. In the spirit of reconciliation, we acknowledge that Manitoba is the traditional land of the Cree, Ojibwe, Oji-Cree, Dakota, and Dene people, and the homeland of the Métis Nation, and we are on Treaty 1 territory. Today, or right now, is our third presentation, and we will be talking about medication safety. And I would like to introduce our presenter, our speaker this afternoon. We have Robyn, and Robyn is a pharmacist and a manager of Tache Pharmacy. Welcome, Robyn. I just want to remind everybody that we can't see you. You will not be able to speak. But if you have any questions, you can use the chat room here or the Q&A chat, and we will read your questions later. We will have about 10 minutes, 15 minutes or 10 minutes before the end, before 3:45, we will have time to read and answer your questions, okay? And at the end of this presentation, we will be giving away 3 gift cards for prizes, and we will select 3 random winners. Okay, welcome everybody, and welcome Robyn.
Thank you so much. I'm just going to share my screen here. Okay. All right, can everybody see that okay?
Yes.
Okay, perfect. So what they've asked me to talk to you guys about today is tips for talking with your pharmacist and some medication safety. So what do you think of when you think of a pharmacist? I think it's quite variable for a lot of people. So some people still are very much in the thoughts of that we're just counting pills behind the counter, we're very intimidating, wearing a white coat, that sort of thing. But other people, and I think more and more people, are starting to think of us as more accessible healthcare professionals and also a valuable source of health and medical information. So it's quite variable pharmacy to pharmacy as to what kind of services they're providing, but what I'm going to talk about today is some of the services that pharmacists in general can provide, as well as some of the specialty topics and how they can help you with any of your medication questions. So just to talk a little bit, a pharmacist goes through a lot of training. So many of you may have actually heard recently that they've added an extra year of training into school from when I went to school. So it's a minimum 4-year, it's a 4-year program with a minimum now of 2 years before you are accepted into the program. And these are some of the topics that we have to learn about in school. So you learn all about the anatomy and physiology. So pharmacists should be able to answer a lot of questions about muscles and nerves, the body parts. We learn a lot about chemistry and microbiology. So it helps to learn about how medications are made, how they're going to work in your body. And then nutrition as well. So we would take a couple of nutrition classes. So for instance, if you had medication questions regarding supplements, over-the-counter products, perhaps even just how to have a balanced diet, we'd be able to help with that as well. We learn things called kinetics, and that's about how the medication moves through our body, as well as pharmacology, which is also how the medications are going to work. We learn about all sorts of natural products, so things that you might see in a natural food store as well. We learn clinical pharmacy, which is sort of our standard medication and diagnoses care, and how to work with the physicians and nurses that are prescribing the products. And then
Hi, Robyn.
pharmaceutics.
Sorry, excuse me.
Mhm.
Sorry. I just want to remind you to speak slowly for our senior immigrant participants.
Sure.
Thank you.
And then we've got the pharmaceutics, which is going to be how the medications are made. So when you're talking about prescriptions, some of you may be familiar with compliance packaging or compliance packing. So this is named, often heard as bubble packs, perhaps pack med strips. Pack med strips are going to be a variety of a bubble pack, but they're in a packaging similar to like a Ziploc bag. It would look more like that. Pharmacists are the ones that are in charge of checking the accuracy of the doses. So pharmacy assistants and technicians will often prepare the medication, and then our job as a pharmacist is making sure that a doctor has prescribed things properly and that the assistant has prepared it, the correct medication and the correct dose for that patient. We are also in charge to check that the medication matches the disease state. So if you came in and you have diabetes, we want to make sure that you're getting medication for diabetes and not for something else. What we're in charge of as well is checking medication interactions. So a great thing for you to do when you have a new prescription is to come to the pharmacy with your prescription, of course, and before we provide you the medication, if you can let us know other medications that you're taking as well, we can make sure that they don't interact with each other. That's very important so that you don't have any adverse or side effects, no drug reactions.
Robyn, can I stop you there for a minute?
Yeah.
We seem to be having a problem with your slides. Like we're still only seeing the very first tips for talking with your pharmacist.
Oh, I'm sorry.
So yeah, we're not, it's, I think you need to, yeah, it's.
Do you see anything now?
Yeah, when you move it, it does, but it wasn't advancing. So we were
now, prescriptions.
Okay, well, I'm just going to leave it like this then. So I'll just try and make it as big as it can be, but we'll just.
So we're on prescriptions now, so that's okay.
Okay, so so the pharmacist is also going to be the person who does your counseling about your medication. So if you had questions about whether you should take your medication with or without food, we would be the ones to tell you about that. Some medications you need to make sure you're spacing apart from other antacids, things like calcium or perhaps magnesium, iron. We would tell you all of that. And also some medications make you more sensitive to the sun. So these are especially important in the summertime when you have more exposure to the sun outside. So we would make sure to tell you this about your medication and to wear a lot of sunscreen as well. And then we would tell you about any sort of side effects that you might need to be aware of, or we call them red flags. So if any of these red flags were to happen, we would want to make sure that you're seeing your doctor right away, or at the very least contacting the pharmacy to let us know. I mentioned very briefly about over-the-counter medications. So what I mean by that is it's all the medications that are out in front of the pharmacy. So things like your vitamins and minerals. We would have any sort of cough and cold products. Perhaps it could be some polysporin, things that you don't need a prescription for, but you might require based on your symptoms. Some of these products are actually kept, even though they're considered over-the-counter products, that they don't need a prescription, we might actually have them right behind the pharmacist just so we can talk to you about them. That might include something like Benadryl for allergies or Gravol for anti-nauseants, for if you're feeling upset stomach or feeling quite nauseous. So in this, we might also be able to suggest the non-prescription medications to take. So for instance, in that case, if you came to the pharmacy and said, I'm having these symptoms, I feel like maybe I have a really stuffy nose right now, what we would do is ask you what other medications you're taking, and then be able to perhaps suggest what might be a good option based on your symptoms. And this would be without having to go see the doctor. Sometimes we will have to refer you to go see your doctor. So that would be, for instance, if the symptoms were more severe than we were able to handle over the counter, if you needed a prescription. And also, if you had anything that was a bit more severe that needed a full diagnosis. So pharmacists specialize a little bit more in medications, whereas doctors and physicians specialize a little bit more in diagnosing and running tests. So pharmacists can also assist with questions about your vitamins and minerals. So often we get questions, especially as we're in flu season right now, about whether you should take vitamin C or maybe vitamin D and how much you should be taking. So that's something that we can help out with. Of course, the bottle often has some suggestions, but based on each individual person or individual patient, we want to give the best recommendation possible. And what we would also do if you came in asking for an over-the-counter product without a prescription is to double check if, let's say, the natural product or the vitamin or the cough medicine that you're going to use interacts with any of the current medication that you're taking. So a lot of the common ones most pharmacists will know off the top of their head, but we do also have a couple of programs on our computers and in our books that give us more information about what to expect when you combine different medications and whether or not that's going to be safe for you. And like I'd mentioned as well, we will also give advice as to when to go see the doctor. So sometimes that can be just about asking questions about maybe what color your stool is or what kind of mucus is coming out of the chest. Perhaps we might actually be able to see what kind of rash you have right now and go from there at that point. So of course, pharmacists are very important in the healthcare field, but the most important thing that we do is collaborate with other healthcare professionals. So as a patient and as a senior or immigrant in the community here, there's many people that will hopefully be helping you with your health and taking care of you that way. So what we will often do is work with your nurse practitioner or your doctor. What we'll do is fax them for any sort of refills if you needed more prescriptions. We may also be able to touch base with them about perhaps any concerns or questions that you have that we aren't able to answer as a pharmacist, that we'd be able to pass on if there was a diagnosis question. We also work with your prescribers to get medication covered. So you may have noticed that some medication is automatically covered through Manitoba Health, or perhaps you have a private plan like Blue Cross or Green Shield, but sometimes there's certain medications that aren't covered automatically. So what we would do is contact your doctor, your nurse practitioner, and what they would do is between the two of us be able to contact Manitoba Health and hopefully be able to get your medication covered for you. So that way your cost will be reduced. We also work with healthcare professionals in a smooth transition in care. So there's many other healthcare providers out there. Of course, you've got most commonly your doctor and nurse, but we do also work with dentists, of course, as well. If you're going in for a dental surgery or perhaps a tooth removal, that we'd be able to take care of your prescription. But especially when you're being discharged from hospital, not only is it a nurse or a doctor that you're dealing with, but quite possibly it might be a physiotherapist or an occupational therapist. So an occupational therapist is generally the person who's recommending any sort of rehab products. So for instance, if you went to the hospital and were needing a walker, or maybe a wheelchair rental, or perhaps might have some trouble getting in and out of the bathtub in the next little bit. Pharmacists also have some training being able to provide those products for you as well and make suggestions to make the most effective treatment. So not only that, but we do also often see prescriptions that may or may not be the best option for our patients. So sometimes what we'll do is contact the prescriber as well and recommend something different. So that might be just based on side effects that you've had in the past. Perhaps it could be because of an allergy that we want to switch to something else. It may also be just a different recommendation that's maybe a newer treatment, but we will work with pretty much all healthcare providers so that we have the best team possible for your health. Now, I'm not sure if many of you have heard about pharmacy and prescription compounding, but what this is that it's making medications from scratch. So like the ladies had said, I work for Tache Pharmacy, and we're a specialty compounding pharmacy. So what we're doing is when there isn't something that's commercially available, which is something when, it'll come in the bottle in pill form, or perhaps it's made in a liquid, we'll actually be able to make it into something different. So we often will use this for veterinary medicine. So if, let's say it was a dog or a cat. We've even done some crazy animals like kangaroos at the zoo. And often we will use this for patients like children who can't swallow pills. So for instance, if the medication that they need is in a pill form, we might take that and make it into a liquid form so that they can swallow it a little bit easier. And this would also be the same for older patients or patients who maybe went for dental surgery and are also struggling to swallow pills. Another option when we would make a special product, so whether that's a pill or something else, is when, for instance, only certain doses are available. So what I've listed here is sometimes if, let's say, there's a 25 milligram capsule and a 50 milligram capsule, but the dose that your doctor would like you to be on is somewhere in the middle, what we would do is actually make that from scratch for you. So you'd be able to have that exact dose. Another really important time to use compounding, so again, making medication in our lab, is let's say a patient has a lot of allergies. So most medications that you receive in a bottle have some preservatives in them, and many have dyes. So of course, the little white pills, which are quite common, there's a lot of little white pills in pharmacy, those tend not to have so many dyes, but any medication that you have that's colored, so whether it's blue pills or purple pills or yellow pills, they'll all have some sort of dye in them. So if there's allergies, we would make something from scratch to be able to prevent that allergic reaction. We'd be able to make a lot of different things for patients. So things like suppositories, for instance, if patients keep throwing up and they're not able to get anything down, we would use a rectal route and use a suppository. Suspensions is what I've mentioned. So that's going to be a powder mixed in a liquid. Chewable tablets or little gummies we'll make as well. Capsules, we'll do lots of creams and gels. So that's a really interesting thing. We find when patients come to us and have a really sore stomach from taking a lot of anti-inflammatory medication for, let's say, arthritis or perhaps an injury of some sort, what we'll often do, just for safety purposes, to make sure that your stomach isn't so sore and we're preventing an ulcer that way, is to move to a cream form. So we'd contact the doctor, and instead of taking pills that cause the stomach upset, we would have it in a cream form that you'd be able to rub it on the area that was hurting. Another option is an eye drop too. So we do make a lot of eye drops in our sterile hood. And basically from that, it would be if there was something that wasn't available, or for instance, it was something in a different concentration, let's say for a child, we'd be able to make an eye drop as well. Pharmacists, like I mentioned, are considered drug specialists. So what we often will do with patients who are on a lot of medications and aren't quite sure which medications they should be continuing on is something called a medication reconciliation, or a MedRec is another name for that. What this means is that together with yourself and myself, we would go through the patient's medication, including all their eye drops, creams, and inhalers, as well as the pills that they're taking. What we would do next is make sure that what the medications are being taken for matches what sort of disease states you've been diagnosed with. So for instance, like I'd mentioned earlier, if you have diabetes, we want to make sure you're taking medication for diabetes. And that's what we would do here. Go through each one by one and make sure there's a reason for why you're taking that pill. We also would discuss any side effects currently being experienced. So for instance, if you're finding that you're having a really sore stomach, or you're having a headache regularly, or maybe your legs are a little bit sore from taking the medication, we would go through that with you and come up with a plan to hopefully get rid of those side effects. What we would do after we're finished going through the whole list of medications is make some recommendations to your doctor or nurse, and potentially to help reduce the amount of medications that you're taking, that we would recommend to discontinue or stop some of the medications that aren't really necessary for you anymore. This happens quite often, actually. Someone maybe gets started on a medication in the hospital and then doesn't really need it after a month or two, but it just continues to be reordered over and over by accident. And what a pharmacist will do is to assist a patient's understanding of their medications and why they're taking them. Some pharmacists actually have extra training and that we can prescribe for, they call it minor ailments. So what this means is that some over-the-counter products and some prescription products that are really helpful if you're needing something that you know, example, what it is. So for instance, if you came in for acne or athlete's foot, perhaps poison ivy, maybe you got poison ivy in the summer, we'd be able to write you a prescription for that so that you didn't need to have the hassle of going to see a doctor if it wasn't in the right time frame for you. So sometimes because physicians and doctors are so backed up with how many patients they're seeing, sometimes it takes a week or 2 weeks to come in and see them. And you might not be comfortable with a walk-in doctor. So you can always think of a pharmacist as another option. So right now we're in prime vaccination season. Many of you, I'm sure, are hearing a lot about vaccines on the news right now. So there's some publicly funded vaccines. So that means that the Manitoba government pays for them. The big one that you're hearing about right now is the flu shot. The other big one you're hearing about right now is the COVID-19 vaccine. So with these ones, most of the time, there's no prescription necessary. You can just walk into your pharmacy and we'd be able to help you out with this. Other options are the pneumonia vaccine, and that's generally for patients over 65, whereas the flu shot you need to get every year. The pneumonia shot you generally just need one time over the age of 65. There's also the tetanus vaccine as well. So that's generally every 10 years that you would get that. Right now for the COVID-19 vaccine, there is currently 2 doses before you get that special QR code that will let you in to a lot of the restaurants and that sort of thing right now. But there is a 3rd booster dose that's now being recommended over, I believe, the age of 70. And if you live in assisted living or a personal care home, of course, that would include as well. With the booster doses, generally it's going to be 6 months after your 2nd dose is when you would be eligible. And you can contact your clinic or your pharmacist for more information as to when we could book you an appointment for that. There are also a few other vaccines that do require a prescription. So they're not considered publicly funded. They would be private. They would require a prescription and you would need to pay for them. So the biggest vaccine in this category would be your shingles vaccines. So those ones, depending on which type you get, it's either 1 dose or 2 doses. There's also travel vaccines. So many of you may have heard of Twinrix, and that would be for hepatitis A and B. With these vaccines, generally there is a small fee that's associated with it because we aren't being reimbursed through the government that way. So most pharmacies, I would think, would be between about $15 and $25 for this injection fee. And there are a few other drugs that we can give by injection as well, most commonly the vitamin B12 shot. So if your vitamin B12 levels were low, that would be an option as well. Pharmacists also have a lot of training in just general health teaching. So I know at our pharmacy, what we'll do is go out into the community to different groups and just discuss not only different disease states, but also specifics about perhaps diabetic supplies, how to use your asthma devices, disease states in general as well. So if you needed more information on high blood pressure, a pharmacist is a great person to get that information from. We also have some pharmacists and some pharmacy technicians that are trained in compression stockings. So if you aren't familiar with that, basically what it is it's a tighter sock that you would wear that would go up to the knee. Sometimes you can't even get them up to the thigh or a full pantyhose to the waist. But what this does is it helps prevent any swelling of the ankle, and it would also help with any sort of varicose veins, preventing them from getting any worse. Pharmacists can also help with nutrition choices. And again, that would be over-the-counter supplements, perhaps things like Boost or Resource as well, or just how to balance a diet with your vegetables and meats and breads. We'd also be able to provide general health information, and if we weren't sure, we could always look it up as well. Another topic that pharmacists deal with is smoking cessation. So some pharmacists actually have prescribing rights for any sort of smoking cessation or to help you stop smoking. And what we do with this is do extra training to help you coach patients through a really tough time. So generally, if you are interested in stopping smoking, we would have either a one-on-one session with our patient in person or over the phone if we needed to. And then what we would do is follow up with them every week or so. And this would be recommending perhaps they should be on a patch to help them quit smoking, or maybe they need to take a pill. So there's a variety of different things to learn from there. Some pharmacists also have more specialty training in travel health. Of course, most of us haven't been doing a whole lot of traveling in the last couple of years, but a pharmacist that's a specialist in travel health is a really good resource if you're planning to travel also in Canada, but specifically outside of the country as well. They can provide travel tips and recommendations of which malaria pills might be required, perhaps which vaccines should be taken, and any sort of prophylactic medication. So that would be things to take with you, either taken already or just bring with you just in case. Like I mentioned before, pharmacists do have some information about veterinary medicine. So if you had a cat or a dog that wasn't doing as well right now, we'd be able to provide them with an antibiotic or perhaps some pain medications. One of the things we do very commonly at our pharmacy is actually insulin for diabetic cats. So we would also help the owners learn how to do the injections and be able to use the needle and syringe that way. And that's where these specialty compounds come into play that we talked about previously. And lastly, there's a few pharmacists that have an extended practice license, and they're able to prescribe a little bit more like a doctor does. So they need a lot of specialty training and work a lot of hours in their field before being approved, but they would see patients in a clinic like a doctor would. Okay, so as you can see, there's a lot of different things that pharmacists do that can help with medication safety. And I think I'm covered everything I wanted to cover, so perhaps we could just take some questions now.
If you have any questions, you can type your questions in the chat. When you see the Q&A chat, Robyn, there's 4 questions so far. If you want me to read it for you.
Oh, I'm seeing, yeah, type here, but it's not showing. Is there a different screen that I need to look at?
Just the Q&A.
Oh, sorry, right there. Okay. Okay. Okay, so question 1 here, yes, I have the pneumococcal vaccine taken every year or after 3 to 4 years. So it's actually only one time in your life generally. After the age of 65, you usually just need 1 dose of that. Second question is, if a child drinks or eats some medicine by mistake and his or her condition deteriorates, what should one do? So I think it's very specific case by case here. Of course, if the condition is deteriorating, you'd want to get them to emergency right away. If it isn't as serious right away, you could certainly call your pharmacist or call your physician and see what they recommend. But if it's quite serious, I would get them to the emergency room right away, especially as a child. This is a great question here. Is it safe to take someone else's medication if you have the same condition? So generally, I would not recommend that. Everyone has, even though you have the same condition, there's many different factors that go into why you would take one medication over the other. There's also differences in dosing too. So for instance, weight might be involved, that sometimes a smaller lady might take a lot less of a dose than a larger man. But generally, before you took someone else's medication, you always want to make sure that you are talking with your doctor and getting your own prescription for it instead. And then the 4th question I have here is consultation on smoking cessation free. So it depends on the pharmacy. Generally, it's not free. Generally, there is some sort of fee associated with it. But depending on, there's actually a new program that's going to be starting in January. That's a Pharmacist Manitoba program that a lot of it will be subsidized. So if you are interested in quitting smoking, I would reach out to your local pharmacy, and certainly you're welcome to give me a call at Tache as well to get more information. Another question that I have here is, does pregabalin cause burning sensations in the body? My answer is going to change per person. Generally, it shouldn't, but I have had a few people complain of that in the past. Sometimes it will improve over time, and sometimes we do need to take them off of that medication and try something different for them instead. Okay. Got a few questions in the chat here as well. Okay, one of the questions is, can I take different drug names at the same time, or do I need to take breaks? So that's a really good question as well. Many drugs can be taken at the same time, but it would be a really good thing to chat with your pharmacist because sometimes they can't be taken at the same time. So for example, one of the things that I'd mentioned is calcium can't be taken with certain medications. So in that case, we'd want to spread it out about 2 to 3 hours. But I would just double check with your pharmacist that you're seeing right now, because a lot of the time you can take them at the same time. And the next question I see is the flu vaccine available in pharmacy? So yes, the flu vaccine is available, I believe, in most pharmacies. Every pharmacy has their own choice whether or not they're going to carry it that year, but I would say the majority of pharmacists do carry it at their pharmacy. I know we still have quite a bit of it, but there has been a big uptake this year, which is great. So I have, what's your recommendation on basic vitamins seniors can take? So if there was something to start out with, I would start with a general multivitamin. Things like Centrum, that would be a brand name, but there's many house brands that are a little bit cheaper as well. And that would give you your overview of vitamins and minerals. Vitamin D is always a good option, not only for seniors, but for general Canadian population, because we don't see enough sun to keep our vitamin D levels up. Vitamin C is another one that I recommend a lot too, especially during that flu season right now. our vitamin C levels tend to be a little bit low, and this helps our immune system boost it. And for most seniors, calcium is a really good option as well because it helps keep our bones strong with the vitamin D. So hopefully that would be my starting. Hopefully that's a good answer for you there. And the next one that I see is the shingles vaccine is very expensive. Are there programs to help seniors with the cost? That's a great question. It is expensive. Unfortunately, none that I'm aware of. No programs with cost right now. Do keep in mind though, it is just a one-time vaccine, so it's not like you're paying for it every year. Generally, it's either 1 or 2 doses, depending on which vaccine that you're getting. So it is a little bit of a pricey one up front, but it probably is going to keep you comfortable versus getting shingles at some point. They can be also submitted if you had a health spending account, you can claim them on your taxes as well. Any prescriptions you should be able to claim on your taxes. So that's always something that you might be able to get a bit of a refund back for. And then I've got questions here about the 3rd COVID vaccine and where. So like I mentioned, most seniors now, I believe it's 70 and up, but they'll probably be bumping that age down in a little bit as well. They are eligible for your 3rd booster dose of the COVID vaccine product. So there you can go back to the super site, or many medical clinics and pharmacies will offer them as well. We currently have some Pfizer doses in stock. The most important thing is it does need to be 6 months after your 2nd dose. So if your 2nd dose was in May or early May, you would be eligible. But if it was after that in June or July, you do still have to wait another month or 2 before you're eligible for that 3rd dose. I've got, why are they not prescribing calcium supplements when I had fracture surgery in my legs and feet? I don't want to specify on each individual case. Most of the time they will recommend calcium, so I'm not sure what the situation was in that specific situation. But generally the problem is too, calcium isn't covered through the government. So you do have to pay it out of pocket. It's not too expensive, but it is a fee that is paid out of pocket. But it generally is recommended. There might be certain situations when it isn't. So I would certainly double check with your doctor or your pharmacist if you did have any questions as to whether or not you should be prescribed that. The next one I see here, is there a difference between vitamin D and D3? And that's a great question. So there's not. It's the same product, but different labeling on different products. So D3 is actually the active form of vitamin D. There is D2 as well, and that's what is in your body that gets converted to D3. So either one, if you're looking at products in the pharmacy or in the health food store or a natural product store, if you're seeing vitamin D or vitamin D3, most of the time it's going to be the exact same product. On very short occasions, sometimes it is vitamin D2, it's very rare, but you would just convert that naturally in your body to D3. So either one is perfectly fine. Okay, so I have a question here about preventative measures to fight shingles, except the vaccine. Unfortunately, most of the prevention would be vaccine related, as far as I'm aware. There are some treatments that can help as soon as you're diagnosed with shingles, that you'd be able to take antiviral medication, or we also compound special pain creams that you can rub onto the back or the side or wherever the shingles has shown up to help with that. But generally the best way to prevent getting shingles is the vaccine.
And we have one more question in the Q&A chat.
Okay. What is your advice to seniors, specifically immigrants, who are hesitant to approach a pharmacist? That's a great question. I would suggest just going to a place where you're comfortable. So I know at our pharmacy, we've chosen, we actually don't generally wear a white coat. We find it a little bit intimidating, so we wear a little bit more business casual wear so that we are a little bit more approachable. But I would go, try and just go when it's maybe not as busy in the store as well, so they've got a lot more time to spend with you. But I would say the majority of pharmacists are very open to speaking to patients. That's really what we're spending most of our day doing. So don't be afraid. We're not going to bite. Everyone's very happy to help. But I would just suggest going to a pharmacy where you're comfortable, and if you find a pharmacist that you connect with, I would just continue to go back to that one pharmacist over and over, and that actually will also help develop that relationship so that they have more information on your healthcare and can provide better advice on that as well. I'm not seeing anything else here, so I think
anything.
Perfect. Well, thank you guys very much for inviting me to speak today. I hope it was helpful for everyone. You're certainly welcome to reach out as well if there's any other questions. I can provide my email address, or I can leave my phone number at the pharmacy as well if anyone has any questions. And otherwise, I hope everyone has a great rest of the day.
For our students at Senior Immigrant Settlement Services, if you have any questions later or tomorrow, you can email me or talk to your teacher. So thank you, Robyn, for being part of our Senior Expo. Again, if you live in St. Boniface area, Robyn is the pharmacist and the manager at Tache Pharmacy. Thanks, Robyn, for that very informative presentation. And now I have the winners of our gift cards. So we have Mona or Ramona. I have Elia, and Jamil. So congratulations. I will email you about the details on how you're going to receive your prizes. So thank you, everyone. Don't forget tomorrow, we are still continuing our Safety Expo. We have scams and fraud tomorrow at 10 o'clock in the morning. So see you all tomorrow. Thank you. Bye.